Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another of our most frequently asked questions, and the question was: after weaning off a ventilator, is it normal to be confused? You can read, watch or listen to the last week's episode if you're clicking on the link below this video. In this week's episode of Your Questions Answered, one of our readers, Robin from the United States, has the following question regarding her son. And she says, my son has diffuse axonal brain damage and now they want to remove his tracheostomy. Can you please help? So Robin writes, hi Patrick, my son, who is 22, was in a car accident. He was on a ventilator for about 3 weeks in intensive care, and he's now breathing on his own with a tracheostomy, and he's in a side room in intensive care. He has been in a coma since the accident, and he has never been induced into a coma. They are now weaning him off the tracheostomy and are hoping he will breathe on his own without the tracheostomy. He has a size 6 tracheostomy, and he's still in a coma and not responding. He coughs, yawns, opens and closes his left eye, sleeps and awakes, feels pain, is on a feeding tube but is not responding to commands. It was on December the 19th, 2013 when the accident happened, and he has diffuse axonal brain damage. I'm extremely worried about him with a tracheostomy out. Let me know please your comments. Thank you for your time and God bless. Hi Robin, thank you for your email. I appreciate the time you are taking to contact us at IntensiveCareHotline.com, and I can feel your concerns, worries and the pain you are going through because of your son's condition and situation. Brain and head injuries take time. However, it is of concern that your son has never been in an induced coma and that he is still not responding to commands after nearly 2 months since the accident. A diffuse axonal brain damage is certainly a big challenge, and it's known that it can cause unconsciousness and a persistent vegetative state after head trauma. That's certainly concerning as a starting point. However, my experience has also shown that head and brain injuries take time to heal, and you must stay positive. Head and brain injuries can take up to a few months until patients sometimes can regain consciousness. Just think about the recent example with Michael Schumacher, for example, the famous Formula One championship. As it relates to your son's tracheostomy, if he has been off the ventilator and is now spontaneously breathing with a tracheostomy, chances that he can breathe without the trachea depend on whether he will be able to swallow and whether he can cough and can clear his airway. Also, keep in mind that after the tracheostomy may have come out, that your son may be in a position to go on to rehabilitation. Brain injuries of this severe nature may require rehabilitation after intensive care in order to improve his situation. I think that it's certainly worthwhile trying to get him off the tracheostomy whilst he is in hospital. A size 6 tracheostomy is a relatively small size and is almost a pediatric or a children's size. The size, however, is not all that important, and as I mentioned before, it's more important that your son can breathe, swallow and cough. Also, check out our Your Questions Answered section if you click on the link below this video, where we answer lots of questions about tracheostomy as well as head injuries in general. Also, visit our blog section where we have more articles about how you can stay positive and other tips and strategies on how to deal with challenging situations whilst your loved one is critically ill in intensive care. Other articles that may be of interest for you and that will help in your situation are the 5 things you need to know if your critically ill loved one is in intensive care with a severe head injury or a traumatic brain injury. The other article that will help you is tracheostomy and weaning off the ventilator in intensive care. How long can it take? And the next article that would help in your situation is how long, or is my critically ill loved one in an induced coma or in a head injury? Feel my presence. You can find links to these articles below this video. Furthermore, how can you leverage your level of power, influence and control whilst your loved one is critically ill in intensive care? You'll get to that all-important feeling of power, control and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn quickly how to get real power and real control and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Our free reports help you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership and download your free Instant Impact Report now. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.